Hello, I'm Dr. Shabab. Today we will be covering the pathogens of pneumonia, a very high yield topic for any exam. By the end of this session, you will be able to confidently identify and diagnose the causative organisms of pneumonia. So let's get started. At first, we have Mycoplasma pneumoniae. In this case, the patient will be from the younger age group residing in a hotel and you will have the features of hemolysis. Sometimes you will get the features of erythema multiforme, that means the target shaped lesions on the skin. After that, we have Legionella. In Legionella, the patient may give history that they have traveled to any country or they travel via any ship, cruise, or especially a country name that is Spain. Sometimes they give the features of low sodium, lymphopenia, altered liver function test, as well as the heart rate will be low, consciousness level will be low, means confusion. Sometimes you will have pleural effusion. After that, we have Streptococcus pneumoniae. This is the most common cause of pneumonia. In this case, you have cold sore and the color of the sputum will be rusty. Then we have Staphylococcus aureus. Here, the patient said that they have a history of flu. After that, they are having the features of pneumonia, such as fever, cough, chest pain, etc. At the time when you will do the chest X-ray, you will find a cavitary lesion. And sometimes they will say that they are IV drug users. After that, we have Klebsiella pneumoniae. In this case, the patient group will be a immunocompromised group, like they use alcohol, they having type 2 diabetes mellitus, and when you will do the chest X-ray, you will have cavitary lesion, and the color of the sputum will be red currant jelly. After that, we have Pseudomonas. It is a common organism among the patients of the ICU, or it is a common organism for severe hospital acquired pneumonia. So we know now the key clues how to diagnose the organisms on the basis of the history. Now let's move towards the diagnosis. For diagnosis, for Mycoplasma pneumoniae, the most confirmatory test is Mycoplasma serology. As well as you can do the IgM cold agglutinin test and also the features of autoimmune hemolytic anemia. If you do a peripheral blood film, you can get the schistocytes, broken cells, and helmet cells. Then come to Legionella. For Legionella, the most confirmatory test is urinary Legionella antigen. As I said before, Streptococcus pneumoniae is the most common organism of pneumonia. For this, we will have the characteristic features of consolidation in the chest X-ray. Then come to Staphylococcus and Klebsiella. In both these cases, you will have cavitary lesions. So how will you differentiate between these two? So you can differentiate between these two on the basis of the history. And for Pseudomonas, you will have the typical features of pneumonia. So up to this, I think you will be able to diagnose the case on the basis of the history and the investigation. Next class, I will try to cover the CARF 65 criteria of pneumonia as well as the management. Till then, take care. Thank you.